This video will cover the breathing mechanism and how our body regulates how fast or how slow you breathe. So breathing, or respiration, has two main parts. There is inspiration, which is movement of air into the lungs, and expiration, which is a movement of the air out of the lungs. We can also think of respiration as having the two parts, one being external, which talks about how these gases are being exchanged in the lungs, and then internal, which is when the gases actually reach body cells and are involved in cellular respiration. Remember, our lungs are spongy because of all the little alveoli, sort of cone-shaped organs. They're smaller at the top and larger at the bottoms that live in the thoracic cavity. And the lungs are made up of a descending number of tubes, bronchi, to create the bronchial tree, that all end in the microscopic air sacs known as the alveoli, or the alveoli, which are lying in the lungs within a network of capillaries. Gases move across the cell membranes of both the lung cells and the capillary cell wall to move into red blood cells for hemoglobin to pick up oxygen, and of course carbon dioxide moves the other way. And this actual movement of the gas from the lungs into the bloodstream is actually driven by differences in concentration. It's a diffusion process. So oxygen levels are lower in the blood and higher in the lungs, and so the oxygen moves into the blood, and carbon dioxide are the reverse. It's lower in the lungs, and so it moves out of the blood into the lungs. Just again, a diagram to show you the anatomy. We've got our lung system here with the trachea coming down, dividing in the right and left bronchi, and then into the many smaller bronchi and bronchioles, down eventually to the alveoli or alveoli, these little grape-shaped air sacs, microscopic air sacs, and then each of those little air sacs, this would be the outside of the air sac, is sitting within a capillary network. So we've got a capillary right alongside of it, and oxygen transfuses across those cell membranes based on concentration. So air actually moves. You don't suck air in, but it's moving in because of differences in pressure. Our atmospheric pressure, the amount of pressure that the air is pushing on you, is about 760 millimeters of mercury. That's one of the many ways that we measure air pressure, and because it's really only small differences that cause air to move in and out of the lungs, it's easiest to talk about it using the unit of millimeters of mercury. When you expand your thoracic cavity, when you inhale, you're actually reducing the internal pressure by just a tiny bit, down to about 758 millimeters of mercury. And that's enough for the air to rush in. It gets pushed in actually by the higher atmospheric pressure on the outside. And then when you exhale, it's a combination of elastic recoil and just the tension on the alveoli themselves that increase the pressure to about 761 millimeters of mercury, and that's enough to cause expiration, or moves the air out because the pressure is higher inside the thoracic cavity, and so that pressure pushes the air out. So basically, it's the same thing that happens if you take a syringe, and if you pull down on the syringe handle, air is going to move in through the nozzle end because you've created a larger cavity inside, and you've decreased the pressure inside, so the air actually pushes its way in from the outside, and the reverse is true if you were to move your plunger up. So it's a combination of muscles that cause this thoracic cavity to change. And of course, your thoracic cavity is bordered by your ribs all the way around. And so when you take air in, you expand the size of the thoracic cavity. The rib cage itself moves up and out, and the diaphragm contracts and move down. So both moving things up and out especially, and then down, you're creating more space inside the thoracic cavity, and that's decreasing the pressure so that air can come in. These intercostal muscles in between the ribs are contracting to move the rib cage up, and also your diaphragm is contracting in order to move down. So inhalation, you've got muscles contracting to expand the thoracic cavity, to expand your rib cage, to pull the air into your lungs. When you expire, the muscles are relaxing, and so your diaphragm will move back up and decrease the cavity and size of the cavity. And the muscles themselves, the intercostal muscles in between your ribs, as they relax, there's elastic recoil. They spring back to their smaller size, and that pulls the rib cage back down and in, and again makes that thoracic cavity just a tiny bit smaller and enough to push the air out. Now, we are not moving the same amount of air in and out of our lungs all the time. Different ways that we breathe or how intensely we're breathing are going to change different amounts. It's going to make the volumes of the air moving different. If you're just sitting and relaxing, you're doing something on your computer or your phone, or you're watching something, then your relaxed breathing tends to run between 12 and 20 breaths a minute. And about 500 milliliters of air is moving in and out and in and out as you breathe in this relaxed state. We call that amount of sort of relaxed breathing, the air that moves, is called the tidal volume. Now, breathing itself is an involuntary act. It's controlled by your autonomic nervous system, but you also can control, you can make yourself take a deep breath, make yourself cough. You can exercise some voluntary control, but if you're not thinking about breathing, it's going to happen anyway because it's taken care of by your autonomic nervous system. Here's a diagram that shows the tidal volume. Somebody's relaxed breathing, things are just going in and out, and this amount of air that's moving is about 500 milliliters. But of course, you can take a deep breath. So if you take a big, deep breath, then you can expand your lungs to what's known as the inspiratory reserve volume. So that's how much more air you can put into your lungs if you take a breath beyond your sort of normal relaxed breathing, your tidal volume. And that's a little bit over 2,000, close to between 2,000 and 3,000 milliliters of air. And again, you can breathe out more. You can, push more air out of your lungs. And so that's your expiratory reserve volume, the little bit more that you can push out beyond your normal relaxed tidal volume. And so we call that amount from the most that you can breathe in to the most that you can breathe out, and sort of using your muscles and in a normal situation, of the vital capacity of your lungs. But that's not all of the air that is in your lungs, because even when you breathe out all that you can breathe out, there's a tiny bit left. And we call that the functional residual capacity. It's kind of dead air in the sense that it's sitting there in your trachea, in your bronchial tubes. It's not being expelled. Sometimes if you get a sharp blow on your rib cage, say you fall, you do exhale into this reserve capacity, and that sort of sometimes it makes it harder to get that next breath. But normally this dead air there's always a small amount of air that's not really contributing to the gas exchange, but it is part of your lungs. So if we add the vital capacity and your reserve capacity together, we get something known as total lung capacity. But we don't use our total lung capacity. Most of the time we're right here just using a little bit of it in our small amount of air that's moving every time we breathe in a relaxed state. There's a number of different parts of your body that is involved in the control of the rate of your breathing, how fast you're breathing, how deep you're breathing. There are nerve respiratory centers, neuronal pools. Remember, collections of neurons that have a common function. They are found in your brainstem, in the medulla and the pons section of the brainstem. And that's what's in charge of maintaining this rhythmic, relaxed breathing automatically. And then also there's some response that's going to happen in the brainstem for certain emotional stress, or if you are upping your physical activity. So your brainstem is pretty much in charge of your breathing. But you also have chemoreceptors in the cerebral spinal fluid that are monitoring carbon dioxide levels. And so there will be triggers based on what these chemoreceptors are detecting so far as how much carbon dioxide is in the blood. Because, of course, if you are doing more cellular respiration and producing more carbon dioxide, you need to get it out of your body. And so that can cause you to increase your breathing rate. There are also chemoreceptors in the aorta and the carotid arteries very close to the heart that measure blood oxygen levels. So you both blood carbon dioxide level and blood oxygen levels are being monitored by your body. And then you have mechanoreceptors, which are involved in making sure you don't take too much air in. So they're monitoring how much your lungs are expanding, how they're stretching to prevent overinflation and possible damage to that tissues when you're breathing forcefully, like when you're exercising hard. Along with these changes in chemistry in our chemoreceptors, if you are upset emotionally or if you're exercising hard, as I mentioned before, they also will affect the breathing rate. So to look at each of those factors in a diagram, because the breathing rate can be controlled voluntarily, the parts of the brain, the cerebrum, which is in your thinking part of your brain, can both increase and decrease the rate of breathing based on your voluntary choice. But so far as involuntary control, we've got our chemoreceptors in the medulla that will respond to carbon dioxide levels going up to increase your breathing rate. We have different chemoreceptors in the carotid arteries and the aorta that will increase breathing rates if oxygen levels go down. You have stretch receptors in the lungs that will decrease breathing rate if you're breathing too hard and too fast and might cause damage. You have proprioceptors in your muscles and joints that will respond to increase your breathing rate when your body, that's how your body figures out that you're exercising, that your joints and muscles are moving more, and so that will increase your breathing rate in response. And then, of course, because we can breathe faster when we're in pain or upset about something, the receptors, sensory receptors involved in touch or temperature or pain detection, can also cause an increase in your breathing rate. And so these messages come from these various receptors to the respiratory centers in the brainstem, in the medulla oblongata and the pons, to make these changes in your breathing rate. There also are a number of things that we do in our respiratory system that are not involved in exchanging oxygen and carbon dioxide. And these movements of air are things that we use to clear the airways or to express our emotions. And so coughing is a response to an irritation in the lower half of your respiratory system. The pharynx is still kind of considered upper respiratory, but it's kind of the bottom of the upper respiratory, and then moving down to the larynx and trachea. So if something is headed towards your lungs, that your lungs would not want that substance to be there, you're going to cough in response to try to keep whatever it is. If it's inhaling some smoke, or you are swallowed something too quickly for your epiglottis to completely close, and so a trickle of liquid is heading down to your trachea, then your body's going to cough to try to get it out of your lungs. In contrast, sneezing is you're trying to get something out of your nasal passages, so some kind of irritation in the highest part of the upper respiratory tract is going to cause a sneeze. Hiccups are caused by a muscular spasm of the diaphragm, and we're not quite sure why that happens. Yawning, we say it's because you're tired or your body needs more oxygen, but the actual stimulus is unknown. We aren't able to show that either one of those happens. We do know it's contagious. One person yawns, or even if your dog or cat yawns, sometimes they can trigger you yawning. And then laughing and crying are basically both made the same way, in that your breath is released in a series of little short expirations. And you have to, sometimes it's hard to tell if somebody laughing or are they crying until you get a chance to look at their face and get some more information to understand what their emotion truly is. So that finishes my overview of the breathing mechanism. So check your understanding. Can you describe how the rib muscles and the diaphragm work together to cause a change in the volume of the thoracic cavity, which then allows inspiration or expiration to occur? Can you explain the difference between tidal volume and total lung capacity and what those words mean? And can you identify the various factors that can influence how fast you breathe, what your rate of breathing is? If you're not sure about any of these answers, go back and listen to that part of the video again. So that concludes what I want to say about the breathing mechanism of your respiratory system.